Causes and prevention of congenital birth defects, environmental, genetic, and maternal factors. Congenital birth defects are physical or biochemical abnormalities present at birth that may affect the structure, function, or development of a baby. They can vary widely in severity, from minor cosmetic issues to life-threatening conditions. Understanding the causes of these defects is crucial for prevention, as many factors, genetic, environmental, and maternal, contribute to their development. Causes of congenital birth defects. Genetic factors, inherited mutations. Some congenital birth defects are caused by mutations in one or more genes. These mutations can be inherited from one or both parents. Chromosomal abnormalities, conditions like Down syndrome, trisomy 21, Turner syndrome, monosomy X, and Klinefelter syndrome, SSY, result from chromosomal abnormalities that occur during cell division. Single gene disorders. These are caused by mutations in a single gene and can be passed from parent to child. Examples include sickle cell anemia, cystic fibrosis, and phenylketonuria. Multifactorial inheritance. Many birth defects arise from the interaction of multiple genes with environmental factors. For example, neural tube defects like spina bifida are influenced by both genetic predisposition and environmental influences like folate deficiency. Environmental factors. Environmental factors refer to external conditions or exposures that may increase the risk of congenital birth defects. These include maternal infections, rubella, German measles. Infection during early pregnancy can lead to birth defects like heart defects, deafness, and cataracts. Toxoplasmosis, an infection caused by a parasite that can lead to brain damage and vision problems in the baby if contracted during pregnancy. Zika virus. Infection during pregnancy can lead to microcephaly, a condition where the baby's head is smaller than expected due to abnormal brain development. Cytomegalovirus, CMV. Infection with CMV during pregnancy can cause developmental disabilities, hearing loss, and vision problems in the baby. Exposure to teratogens. Teratogens are substances that can cause birth defects if a pregnant woman is exposed to them during pregnancy. These include alcohol. Drinking alcohol during pregnancy can lead to fetal alcohol syndrome, FAS, which includes physical and developmental abnormalities like growth problems, facial deformities, and intellectual disabilities. Drugs. Certain prescription medications, illegal drugs, and over-the-counter drugs can cause birth defects. For instance, thalidomide caused limb deformities when taken during pregnancy. Tobacco. Smoking during pregnancy increases the risk of premature birth, low birth weight, and birth defects such as cleft lip and palate. Pesticides and pollutants. Exposure to harmful chemicals in the environment, such as pesticides, lead, and air pollutants, can increase the risk of birth defects. Radiation exposure. Pregnant women who are exposed to high levels of radiation, e.g. medical x-rays, can increase the risk of birth defects in the baby, especially during the early stages of pregnancy. Maternal nutrition. Folate deficiency. Lack of folic acid, vitamin B9, during early pregnancy can result in neural tube defects, e.g. spina bifida, and other developmental defects. Folic acid supplementation is crucial in preventing these conditions. Vitamin A deficiency. Severe vitamin A deficiency in pregnancy can cause defects in vision, heart development, and limb formation. Obesity and overweight. Maternal obesity can increase the risk of heart defects, cleft lip and palate, and neural tube defects in the baby. Maternal factors. Several maternal health conditions and lifestyle factors can increase the risk of birth defects. Age of the mother. Women over the age of 35 are at higher risk of having babies with chromosomal abnormalities, such as Down syndrome. Maternal age is also associated with an increased risk of miscarriage and preterm birth. Chronic health conditions. Pre-existing conditions like diabetes, high blood pressure, and thyroid disorders can increase the risk of birth defects. Poorly controlled diabetes during pregnancy, for example, increases the risk of congenital heart defects and neural tube defects. Obesity. Maternal obesity is associated with an increased risk of birth defects, including heart defects, cleft palate, and spina bifida. Preconception health. The health of the mother before conception plays a significant role in the development of birth defects. A woman with good preconception health, including balanced nutrition, a healthy weight, and appropriate medical care, is less likely to have a baby with birth defects. Multifactorial causes. Many congenital birth defects are caused by a combination of genetic and environmental factors. This includes conditions such as cleft lip and palate. The condition may result from a combination of genetic susceptibility and environmental influences such as maternal smoking or certain medications. Neural tube defects. These defects, e.g., spina bifida and anencephaly, result from a combination of genetic factors and environmental exposures, such as folate deficiency or maternal diabetes. Congenital heart defects. Many congenital heart defects are believed to arise from a combination of genetic mutations and environmental exposures, such as maternal smoking or viral infections during pregnancy. Prevention of congenital birth defects. While not all birth defects can be prevented, there are several strategies that can reduce the risk of congenital defects. Prenatal care. Early and regular prenatal visits. Early prenatal care can help identify any risks or complications in pregnancy and address them promptly. Regular visits ensure that the mother's health is monitored and that the baby's development is on track. Folic acid supplementation. Taking folic acid. Women planning to become pregnant should take folic acid supplements before and during early pregnancy to reduce the risk of neural tube defects. The recommended dose is 400 micrograms per day. Healthy lifestyle choices. Avoid smoking, alcohol, and drugs. Pregnant women should avoid smoking, drinking alcohol, and using illicit drugs, as these substances can lead to birth defects. Proper nutrition. A well-balanced diet with adequate nutrients, including vitamins, minerals, and proteins, supports proper fetal development. Women should also manage conditions such as obesity or diabetes to reduce risks during pregnancy. Genetic counseling for families with genetic risk. Couples who have a family history of genetic disorders or are carriers of certain genetic conditions may benefit from genetic counseling before trying to conceive. Genetic testing can help assess the risk of passing on inherited conditions and guide decisions regarding conception. Vaccinations. Getting vaccinated. Women should ensure they are vaccinated against infections such as rubella, which can cause severe birth defects if contracted during pregnancy. Vaccination before conception helps protect both the mother and the baby. Managing chronic conditions. Diabetes. Management for women with diabetes, managing blood sugar levels before and during pregnancy reduces the risk of birth defects. Well-controlled diabetes minimizes risks for the baby, including heart defects and neural tube defects. Avoiding environmental toxins. Limit exposure to toxins. Pregnant women should avoid exposure to harmful chemicals and pollutants, including pesticides, lead, and radiation, which can increase the risk of congenital birth defects. Maternal age consideration, prenatal screening for older mothers. Women over 35 should consider genetic screening and diagnostic tests such as amniocentesis or CVS, chorionic villus sampling, to assess the risk of chromosomal abnormalities like Down syndrome. Conclusion: congenital birth defects are caused by a combination of genetic, environmental, and maternal factors. While some birth defects are unavoidable, many can be prevented through proper prenatal care, healthy lifestyle choices, adequate nutrition, and genetic counseling. By understanding the causes and prevention strategies, expectant parents can take proactive steps to reduce the risk of birth defects and increase the chances of a healthy pregnancy.